Unless you are updated yourself, I think you will perform below par compared with dentists who are up to date. 4 fractured files within 4 canals.
Okay.
In addition, there was a perforation. Obstacles are really good for you. It's not only in your life, in your work also. As you face your obstacles, as you overcome it, you become a better person.
Hi viewers, this is Dr. Prince. Welcome back to your channel, Dental Treasures. So Dental Treasures is a community where we pull in the top mentors in our dental society, and they give you the priceless tip which will save your money, time, and above all, it gives you a hassle-free practice. I know many of my viewers will like and subscribe the channel, but I highly request you to watch the video till the end. Otherwise, you'll miss a lot of vital information. And also, I highly recommend you maintain a dental journal and please note down the important information which is provided by these top mentors. And this will help you to effectively practice your dentistry. Most of the dentists, if they have to acquire additional knowledge, they have to take time from the busy schedule and they have to invest either by reading books, articles, or attending CD programs. But frankly, does anyone does that? No. So this is where I step in to help you guys know the trending topics in dentistry with the top mentors. We have been getting a lot of requests to interview this individual, and because of this, I had to travel all the way from Bangalore to Kochi, and finally he's agreed to spare some time with us. If I have to mention his contribution, probably I need one entire episode. Without further ado, let me introduce Dr. Jojo Couture, a very well-known micro-endodontist who's globally earned his name in the dental community. Dr. Jojo Couture, MDS, is an academician and clinician of international repute in the field of restorative dentistry and endodontics. He has more than 50 indexed publications to his credit with 1,500 plus citations. He has contributed to many national and international restorative and endodontic textbooks. The Indian Association of Conservative Dentistry and Endodontics awarded him the Best Reviewer in the year 2015, Clinical Excellence Award in the year 2017, Rising Star Award in the year 2018, and Academic Excellence Award in the year 2022. Presently, he is affiliated as a professor in Royal Dental College, Kerala, and maintains a private practice, Root Canal Point, limited to his specialty at Kochi. Sir, welcome to the show, and thank you so much for agreeing to join us, sir.
Thanks, Dr. Prince. Indeed, it's my pleasure to be a part of your YouTube channel, Dental Treasures. I would like to personally thank you for the invite.
So, what made you choose endodontics over the other subjects?
To be honest with you, once I had finished my undergraduation, I always wanted to be a prosthodontist. You know why? It's primarily because I was good in teeth setting, and I indeed got first prize in a teeth setting competition way back in 2004 when I was an intern doing my undergraduation. So I liked prosthodontics at that time, and because of that reason, primarily I would like to join prosto for my post-graduation. But lately I understood the fact that whatever we are learning in prosto, we are partially learning in endodontics also. It's because our specialty is not only endo, but also respiratory division also is there. So the first disease that can happen to a tooth, that's dental decay. To the last resort in preserving the tooth, that's with endodontic or root canal treatment. Both falls in this particular specialty. So the respiratory part division actually deals with the restorations, and the endodontic part deals with root canals and root canal treatment. So I think I had taken the right choice in taking this specialty over the prosto.
Considering your time in dentistry, how is your journey so far? And what are the obstacles that you faced and how did you overcome them?
Regarding the journey so far, I think it's very much excellent. And regarding obstacle, yes, any journey will have obstacles. It's not only in endodontics, it's everywhere it's like that. And my dad always say, obstacles are really good for you. It's not only in your life, in your work also. As you face your obstacles, as you overcome it, you become a better person, and that's how you improve. So endodontics in particular have a lot of obstacles. For example, my portfolio of endodontic work, which I do in my clinic root canal point, is primarily re-root canal treatments. 70% of the portfolio is re-root canal treatments. So re-root canal treatments are real challenges. It's an obstacle because I'm going to rectify someone else's mistake. So each time I rectify it, I actually is improving myself. So I always take obstacle in a positive note. I think they're really good, not only in your work, but also in your life.
Yes, that's a fabulous reply. So who was your mentor, especially when you started your dental career?
When I started my dental career, I don't think I had any particular mentor because I was the first dentist in my family. But I have to say, my mentor in life is my dad, my father. But coming to a question, in dentistry, I would say, in particular in endodontics, my mentor is always my HOD, my postgraduate HOD, Dr. Velmurugan. I would like to list out few other names. In endodontics, Dr. Gopi Krishna, and in restorative dentistry, Dr. Mohan B. So to summarize, I tried to mimic all of them. I tried to mimic Gopi sir and Vel sir in endodontics and other aspects, and Mohan sir in restorative dentistry. So probably that could be the reason why I could do better work both in endo and in restorations.
So you were one of the first practitioner to start a referral based practice, especially the micro endodontics. So what made you to choose about this, and what were your fears and anxiety?
So when I finished my post-graduation, I always wanted to practice in the way I had been taught during my post-graduation. And it was actually quite different from what I had seen in many other dental clinics. So that's why I thought I have to start a clinic, probably something that I had dreamed of for a very long time. But putting a clinic like my dream was not easy at that time, because there is so much of factors involved in putting a clinic like that. For example, you need the right place, you need the right building, you need to have the financial backup to start a clinic like that. But for some or the other reason, finally it had started in 2016. That's how the root canal point had been inducted. So when I started this clinic, many had told that it's not the right way to start a clinic. It is better to go back to the conventional way, that's a multidisciplinary practice, rather than a referral based practice with microscope. But the one person which stood with me at that time and was my dad, who told me that don't do like what others are doing. If you would like to do it in this way, go ahead. I will support you. If there is any issue, I'll take care of it.
Okay.
So that was a big boost for me to start a referral based practice, and I think with my mother's support, I would able to initiate this clinic in the name Root Canal Point.
I'm sure you must have received a lot of compliments. So any particular compliment, especially from the international doctor, which made you very satisfied?
I would say this was an incident that happened maybe in 2016.
Okay.
So one of my senior and my good friend, Dr. Abirajidan, he actually happened to visit Switzerland for a dental program. And he was representing India, and many other dentists represented other countries and also had been a part of that show. So Abhi was actually interacting with one dentist from France, And he was telling about India and where he is practicing, and he said, I'm practicing in one of the southernmost state in India. And he asked, you know anyone from India, to that person? And he actually told, I know one dentist from India, and that's Dr. Jojo Couture. So Abhisar said, hearing your name, I got so happy and proud, and I proudly said to him that he was my junior when I was doing my post-graduation. So when Abhisar had told this, when he returned back to India, I think that's a moment that had made me extremely happy, and I would rate this as one of the best compliment I could have got from an international speaker or an international dentist.
So you have treated various challenging cases. What is the most challenging case that you have ever come across?
That's a tough question. Actually, majority of the referred cases to me are challenging cases. But one thing or one case which is popping into my mind right now is a case of lower molar. It was a 3-rooted lower molar. We call it as radix intermolaris. And there was 4 fractured files within 4 canals.
Okay.
In addition, there was a perforation. I think the dentist who had performed that job probably was in a bad mood. And I always say endodontics is a mood-dependent procedure. So if you are in a bad mood, you always do bad endo. But I think that's the most challenging case I had tackled so far in my referral-based practice. I might have taken around 3-4 hours, including 2 or 3 visits. I'm not sure regarding it, but I think I might have taken this much time and visit for tackling that case. But it's not about the time or the money involved in it, but it's the outcome. So it's been done around 4-5 years back now. And recently the patient visited me for some other reason, and the tooth is still surviving. So the happiness what you get when you see the outcome of your hard work, and that's undescribable.
Yeah, that's satisfaction.
Yeah, satisfaction, right.
Yes, yeah. So considering the quality of work that you give to the patients, I'm just asking out of curiosity, like how many cases do you take up per day?
Per day, I would say in a regular day, I will take 4 or 5 patients. So you may be wondering why only 4 or 5, and the answer is quite simple. I can't do more than that because we are doing precision endodontics or restorative dentistry. We primarily do it under microscope or scope. That will give you enhanced vision. So obviously the quality of work that you're doing is very high. And if you want to do quality work, you need time. And one thing which I had made very particular was I don't want to have too much patients waiting for me at my reception. It's primarily because if someone is waiting for me and I'm doing a job, we always have a tendency to compromise the existing work that we are doing because we have to see someone else. I don't want to do that. So that's why I always schedule my appointments for a particular time. So that's primary reason why I restrict my patients to 4 or 5 max per day.
Sir, you're a person who likes to keep things updated. But still, there are some doctors who stick to their old methods. So why do you think it is important for a doctor to get updated?
I would say it's a very important question. I highly recommend to keep things updated. You know why? Because dentistry is evolving. The technique, the concept, what we learned maybe 20 years back will not be right at this moment, and that's how science is. The concept, techniques, the materials, the way in which we do it, everything changes over time, right? So if you're not updated, what you might have learned 20 years back, we will be still practicing the same, thinking that that's right. And I would say that's one of the big mistake that we can do, because since you are not updated with the concepts and technique we are doing in the conventional way. So it's very important for us to get things updated, and dentistry, in particular endodontics and restorative dentistry, is evolving like software updates. So every 6 months you get an update. So unless you are updated yourself, I think you will perform below par compared with dentists who are up to date in their subjects. So it's a very relevant question, and I would say it's very important for us to get things updated, both in knowledge and in skills.
So you had a lot of interesting controversies.
Seriously,
Yes.
against me.